question is, which scaphoid fractures should I worry about? The scaphoid is the most common carpal bone you fracture. A history of a fall on an outstretched arm and tenderness over the snuff box means you should suspect a fractured scaphoid. Ask for x-rays of the wrist along with a dedicated scaphoid view. The waist is the most common place to fracture, followed by the distal, then the proximal pole. The scaphoid is a problem. The proximal 80% of the scaphoid is supplied by the dorsal palmar branch of the radial artery via retrograde flow. So, the more proximal the fracture, the bigger the chances of osteonecrosis from compromised blood flow. Up to 25% of x-rays are negative for a fracture, despite there actually being one present. In these cases, treat the patient as if the scaphoid is fractured. That is, put them in a thumb spica splint and refer them to a hand clinic or GP for follow-up. In some EDs, the patient will get an MRI booked to exclude a fracture that the x-ray missed. However, generally this is not very valuable and is expensive. CT scans are a bit less sensitive and specific than MRIs, but are much more available. I tend to book a CT and make sure the results followed up. If there's a non-displaced or less than 1 mm displaced fracture, splint the patient, refer them to an orthopedic surgeon or to the hand clinic to see them within, well, about a week. 90% of these fractures will get union. However, if the fracture is displaced greater than 1 mm, rotated, or a proximal pole fracture, get orthopedics to see them in the ED. These are unstable and have a much higher rate of non-union and osteonecrosis. Okay, done.